According to the American Cancer Society, more than 12,000 cases of cervical cancer are diagnosed in the United States each year, and over 4,000 women die of it annually. There is hope, however, thanks to an FDA-approved HPV test. Human papillomavirus, also called HPV, is recognized as the main cause of cervical cancer. Estimates have placed the lifetime likelihood of getting genital HPV to be in the range of 75 to 90%. Dr. Larry Glad is the director of the Department of Surgery at Uniontown Hospital in Pennsylvania.
While the majority of women can clear the HPV infection, those patients where the viral infection continues, where it persists, are at the risk for either having precancerous or cancerous lesions occur.
Cervical cancer is one of the most preventable cancers. If you're between the ages of 30 and 65, having a regular Pap test in conjunction with a high-risk HPV test is one of the best ways to protect yourself. Kristen Lukasco is 41 years old. A mom of two working in the healthcare industry, Kristen takes her health seriously.
I had an annual exam with Dr. Glad. We did a Pap smear, and he included the screening for the HPV virus. My results showed severe dysplasia, precancerous cells on my cervix. He explained that I would need to either have part of my cervix removed, or the other option would be a total hysterectomy.
Many cervical cancer screening guidelines recommend co-testing, the combination of a Pap test and a high-risk HPV test for women 30 to 65 years old.
A Pap test looks for abnormal cells. A sample of cells from the cervical lining and from the surface of the cervix are taken and examined. Over the past generation, the Pap smear has been the cornerstone for cervical cancer screening. It has significantly reduced the number of patients with cervical cancer and patients who've died from cervical cancer. Unfortunately, the Pap test is not perfect. Having a negative or normal Pap smear doesn't guarantee that you're cancer-free.
I've had my annual Pap smears. I've never showed any symptoms of the HPV virus.
Research shows there are 14 high-risk HPV strains which cause cervical cancer, and 2 of those 14 types, HPV 16 and HPV 18, are the bad players, causing approximately 2/3 of cervical cancers. Women with HPV 16 and or HPV 18 genotypes are at the highest risk of cervical cancer, even if they have normal Pap results. A landmark study called the Athena study conducted by Roche Diagnostics showed nearly 1 in 7 women 30 years or older who tested positive for HPV 16 had high-grade cervical disease despite normal Pap results.
I've had patients with routine cervical cancer screening who've had a negative Pap test but were positive for HPV 16, which is the virus that causes the majority of cervical precancer and cancer.
The devil is in the details, which is why Roche introduced the cobas HPV test, the only clinically validated FDA-approved test that simultaneously provides individual results on the highest risk genotypes HPV 16 and 18 and a pooled result for the 12 other high-risk genotypes.
Kristen had routine cervical cancer screening, including a cobas HPV DNA test and a Pap cytology test. Her Pap test results were abnormal, but the cobas HPV test was positive for HPV 16. The enhanced risk stratification of the cobas HPV DNA test allows physicians to focus on those patients who are in need of aggressive treatment and to reassure the vast majority of patients who are at very low risk.
Because of the precancerous lesions, the positive HPV test, and prior experience with thyroid cancer, Kristen made the personal decision to have a hysterectomy in January of 2012 and feels the cobas HPV test was effective in identifying her risk.
Adding the cobas HPV test changed my life drastically. If I hadn't had that test, I wouldn't have known the severity or even known that I had HPV, and I could have ended up with full-blown cervical cancer.
If you're a patient and your clinician determines HPV testing is appropriate for you, ask for the cobas HPV test. For more information about the cobas HPV test, go to www.hpv16and18.com.